The latest data from the CDC shows a sharp rise in the maternal mortality rate, and women of color are much more likely to die from a pregnancy-related cause.
But Denver Health seeing success with a free doula program staffed by volunteers. Your reporter for Denver, Jasmine Arenas, shows us a company helping improve birth experiences.
Since 2019, Claudia Davis has been volunteering for Denver Health's doula program.
Time goes by really fast when I'm on the floor because I'm right there helping a woman, and a 12-hour shift can feel like it goes by like that.
She volunteers 2 to 3 times a month.
It's cost prohibitive to hire a private doula. It's kind of seen as a luxury when really it's a resource that positively impacts the outcomes for both mom and baby.
Hiring a private doula can cost up to $1,000. The financial restraints affect low-income people and people of color the most, but they're also the moms who'd benefit the most from these services.
This isn't just a problem in Colorado, but it really is a national health issue as well.
By taking away the financial burden, the Denver Health program aims to improve maternal health and reduce disparities in birth outcomes for patients at highest risk.
I've labored with a lot of women who have immigrated to this country where their family is still back home. A lot of incarcerated women who are laboring completely alone kind of need someone as a guide that can demystify and explain some of the physiologic changes that are happening in their body.
Denver-based company Goldbug donates to the cause to help with retention and recruitment.
And since making the donation to Denver Health Doula Program, we've seen an increase in the number of doulas that they have. It's been about a 36% increase in doulas, as well as an increase in BIPOC and person of color doulas. That's been about 150% increase since the program, since we started working with the program.
Studies show doula care is associated with a reduction in the number of low birth weight babies, C-sections, and increased rates of breastfeeding.
On Wednesday, the governor signed a bill into law requiring the state to seek federal authorization for Medicaid providers to provide doula services for those pregnant and postpartum individuals. In Denver, I'm Jasmine Arenas covering Colorado First.
And Jasmine is your reporter for the Denver area. You can send her story ideas through cbscolorado.com or calling 303-863-TIPS.